Peaky Blinders delves into a wide range of issues concerning Thomas Shelby, including his mental illness, family, and substance abuse. The show takes place during a period of great political upheaval following the horrific events of World War I, which had a profound and long-lasting impact on many of the characters. So, what exactly is Thomas Shelby's mental illness? Tommy Shelby suffers from PTSD. Post-traumatic stress disorder, also known as shell shock, is a mental disorder that can develop after a traumatic event such as sexual assault, warfare, traffic accidents, and other threats to one's life. Recurrent, unwanted, distressing memories or dreams of the traumatic event is one of the major symptoms of PTSD. Peaky Blinders' character who appears to be suffering from it include Thomas Shelby, Arthur Shelby Jr., and Danny Wishbang. PTSD symptoms usually appears within 3 months of the event. However, in some cases, they do not begin until years later. The illness and duration can vary. Some people recover as little as 6 months, while others take much longer. PTSD symptoms are frequently classified into 4 major categories, which include reliving. People suffering from PTSD repeatedly relive the trauma through their thoughts and memories of it. Flashbacks, hallucinations, and nightmares are examples of these. They may also be distressed when certain things, such as the anniversary date of the events, remind them of the trauma. Avoidance. The individual may avoid people, places, thoughts, or situations that remind them of the trauma. This can result in feelings of detachments and isolations from family and friends, as well as a loss of interest in previously enjoyed activities. Excessive emotions, difficulties relating to others, including feelings or showing affection, difficulty falling or staying asleep, irritability, outbursts of anger, difficulty concentrating, and being jumpy or easily startled are all symptoms of increased arousal. Physical symptoms may include increased blood pressure and heart rate, rapid breathing, muscle tension, nausea, and diarrhea, negative cognitions, and moods. These are thoughts and feelings related to blame, estrangement, and traumatic event memories. In the first scene of the series, Thomas Shelby is seen dreaming about a memory from the war. He is in the tunnels with Danny Owen and Freddie Thorne, trying to listen in from the other side of the tunnel wall. Their enemies attack, beat, and strangle them, and Thomas awakens with a start breathing heavily. He later describes how he sees his own wall as a tunnel wall, hearing digging and hoping that the fictitious German soldiers do not break through, a recurring event he has last night. Danny Wishbang makes his first appearance in the show with a violent outburst, barreling through the doors of the Garrison pub, knocking over tables, breaking glasses, and shouting repeated words as if he is still at war. His psychotic episodes are what earned him the moniker Wishbang, after the noise made by a German artillery shell. Danny's recurring episode later caused him more problem in the show because they occur in locations where neither Thomas nor Freddie are present to assist. Arthur Shelby Jr. differs from Thomas and Danny in that he does not appear to have recurring memories or haunting dreams of the war. However, the experience continues to bother him and influence his behavior, particularly when provoked or during a fight, causing him to lose complete control over his impulse to kill whomever he is fighting, such as an innocent young boy in the boxing ring whom he beats to death. The smoking of brown opium with a clay pipe is Thomas Shelby and Danny Wishbang's method for refueling stress and symptoms. In the first episode, Thomas is seen lighting the opium, igniting it, and drawing from it. Professional PTSD treatment is given on an individual basis and has advanced to a much higher level of understanding, whereas the time set for Peaky Blinders, there was little to no treatment available because the symptoms were only just becoming apparent. One common treatment activity is for the patient is to relive the entire traumatic memories on their own terms in order to understand that these events were real and that the patient is no longer in danger. Everyone reacts differently to traumatic events. Every person's ability to manage fear, stress, and the threat posed by a traumatic event or situations is unique. As a result, not everyone who experiences a traumatic event PTSD. In addition, the type of help and support a person receives from friends, family members, and professionals after a traumatic event may influence the development of PTSD or the severity of the symptom. War veterans first brought PTSD to the attention of the medical community, hence the name shell shock and battle fatigue syndrome. Anyone who has experienced a traumatic event, on the other hand, can develop PTSD. People who were abused as children, or who were repeatedly exposed to potentially lethal situations are at risk of developing PTSD. Victims of physical and sexual assault have the highest risk of developing PTSD. If you have a history of other mental health problems, blood relatives with mental health problems, or a history of alcohol or drug abuse, you are more likely to develop PTSD after a traumatic event. Approximately 3.6% of adult Americans, or 5.2 million people, experience PTSD in a given year, and an estimated 7.8 million Americans will develop PTSD at some point in their lives. PTSD can manifest itself at any age, including childhood. PTSD is not diagnosed until 1 month has passed since the traumatic event. If PTSD symptoms are present, the doctor will begin the evaluations with a thorough medical history and physical exam. Although there are no specific lab tests for PTSD, the doctor may use a variety of tests to rule out physical illness as cause of the symptoms. If no physical illness is discovered, you may be referred to a psychiatrist, psychologist, or other mental health professional who specializes in diagnosing and treating mental illness. Psychiatrists and psychologists use special design interview and assessment tools to determine whether a person has PTSD or another psychiatric condition. The doctor makes a diagnosis of PTSD based on reported symptoms, including any functional issues caused by the symptoms. The doctor then determines whether the symptoms and levels of dysfunctions points to PTSD. PTSD is diagnosed when a person experiences PTSD symptoms for more than a month. The goal of PTSD treatment is to reduce emotional and physical symptoms, improve daily functioning, and help the person cope with the event that caused the disorder. PTSD treatment may include psychotherapy, medication, or both. Certain antidepressant medications are used by doctors to treat PTSD and to control anxiety and its symptoms, including SSRIs, or selective serotonin reuptake inhibitors, include citalopram, fluvoxamine, fluoxetine, paroxetine, and sertraline. Amitriptyline and isocarboxyxate are examples of tricyclic antidepressants. Devalproex and lamotrigine are mood stabilizers. Aripiprazole and quetiapine are examples of atypical antipsychotics. Certain blood pressure medications are also used to treat specific symptoms: prazosin for nightmares, clonidine for sleep, and propranolol to reduce the formations of traumatic memories. Experts advise against using tranquilizers such as lorazepam or clonazepam for PTSD because studies have shown that they are ineffective and they carry the risk of physical dependence or addiction. Psychotherapy is another treatment for PTSD. It entails assisting the patient in learning skills to manage symptoms and develop coping mechanisms. Therapy also aims to educate the individuals and their family about the disorder, as well as to assist the individual in working through the fears associated with the traumatic event. People with PTSD are treated using a variety of psychotherapy approaches, including cognitive behavioral therapy involves learning to recognize and change thought patterns that result in problematic emotions, feelings, and behavior. Prolonged exposure therapy is a type of behavioral therapy in which the person is forced to relive the traumatic event or is exposed to objects or situations that cause anxiety. This is done in a secure and well-controlled environment. Prolonged exposure therapy assists the individual in confronting the fear and gradually becoming more comfortable with frightening and anxiety-inducing situations. This has been very effective in treating PTSD. Psychodynamic therapy helps people examine their personal values and the emotional conflicts by the traumatic event. Family therapy may be beneficial because the person with PTSD behavior can have an impact on other family members. Group therapy may be beneficial because it allows the individual to share thoughts, fears, and feelings with other people who have been traumatic events. Desensitization and reprocessing is a complex form of psychotherapy that was developed to alleviate the distress associated with traumatic memories but is now also used to treat phobias. PTSD recovery is a gradual and ongoing process. PTSD symptoms rarely go away completely, but treatment can help people learn to manage them more effectively. Treatment can result in fewer and less severe symptoms, as well as a greater ability to manage trauma-related feelings. Research into the factors that contribute to PTSD and the development of new treatments is still ongoing. Want to know more things about the Peaky Blinders or Thomas Shelby? Then like and share this video and also subscribe to our channel for more such exciting content. Thanks for watching, see you in the next one.